Hello guys, welcome to Anima Anatomia. My name is Jay.
And I'm Tanish.
Today we will be learning about the bones of lower limb.
Let's have a look.
First we will study coxa bone, which is also known as hip bone, and first we will look at the dimensions of the bone. This is the ischium, this is the pubis, and this is the ilium. First, how to differentiate with anterior and posterior. Let's assume I am holding a gun and this is my triggered finger, and this one part is the anterior part where the triggered finger is going, and this is the posterior part. And first, now this is the anterior superior iliac spine, this is the anterior inferior iliac spine, this is the iliac crest, and this is the auricular surface of the ilium bone which articulate with sacrum bone. And this one is the posterior superior iliac spine, this is the posterior inferior iliac spine, this is the sciatic notch, greater sciatic notch, and from here the ischium bone will start. This is the ischium tuberosity, this is the ischium spine. Right here this is the lesser sciatic notch, and this is the ischium tuberosity. Right here this is the ramus, and this is the inferior ramus of the pubis. From here the pubis bone will start. This is the inferior ramus, this is the superior ramus, and right here this is the area where pubic symphysis will form, and the fiber cartilage will fill in this gap. And if this is the fossa, this is iliac fossa. Right here you can see, and let's have a, there is a pubic tuberosity, and this is the pubic crest right here, and this is the foramen, this is the obturator foramen, this is acetabulum where the femur bone will articulate. Let's have a look on the real pelvis. This right here, this is the pelvic brim. This you can see, this is the joint, this also known as sacroiliac joint, which I already show you. Right here this articulate with sacrum, form sacroiliac joint. This is pubic symphysis, and if anything above the pelvic brim, this is false pelvis, and if anything below the pelvic brim, this is true pelvis. And this is the arc of pubis, pubic arc, and if this is broad, then it will be female's pelvis, and if it will be less broad, then it will be male pelvis.
Guys, this is our femur bone. As you can see, this is the posterior aspect of our femur bone. Okay, over here we have the head of our femur, which has hyaline cartilage present on it, which helps in the attachment of the femur bone to the acetabulum cavity. And two structures we can see over here, which is the greater trochanter and the lesser trochanter. Okay, so in between this greater and lesser trochanter, there is an intertrochanteric line present over here. Okay, so as we go little further down, we have a little tuberosity over here called as the gluteal tuberosity, whereas all the gluteus muscles attach over here. And as we go little bit down the shaft of our posterior aspect of our femur bone, we can see the linea aspera. Okay, so this linea aspera we can palpate over here, which attaches various hamstring muscles. Okay, so this is the linea aspera, as I said, where the hamstring muscles attach. Okay, down we go to the shaft, we can see the lateral condylar line over here and the medial condylar line over here. You can see this is the lateral condylar line and medial condylar line. Okay, and as we go down over here, we can see two supracondyles. This is the lateral supracondyle, this is the medial supracondyle. Okay, and there's a little space between these two condyles. This is called as intercondylar fossa. Okay, and over here we can see two small condyles. This is called as the lateral epicondyle, and this is called as the medial epicondyle. Okay, where the other muscles which come and attaches over here. Okay, guys, now we'll see the anterior aspect of our femur bone. Okay, so we come to the anterior side of our femur bone. Okay, as I said, this is the head of our femur, and over here you can see a small line running through it. This small line is called as intertrochanteric line, which joins the greater and lesser tubercle. Okay, and now what I'm going to do is I'm going to slide it little down the shaft towards the distal epiphysis. Okay, this is the distal epiphysis. As I come down the shaft towards the distal epiphysis, we have small divot over here. This is called as the divot of our knee. Okay, where the sesamoid bone or the patella which sits over here. Now the 2 points I want to tell you guys, important points, is called as So over here, this small opening is called as fovea capitis, in which the ligaments coming from the coccyx bone attach to this, the head of our femur. So this fovea capitis, and over here I'm wrapping my hands over here. This is called as the surgical neck of our femur. Okay guys, that is about our femur bone. We'll see the next.
Now we are going to take a look at tibia and fibula. This is the tibia, which is medially side, and this is the fibula, which is lateral side. How to remember? Tips on the medial side and fibs on the lateral side. This is the proximal epiphysis of the tibia bone. Right here, this is the articulating surface of the lateral condyle. This is articulating surface of the medial condyle. This is intercondylar eminence. And this is the lateral. This is the lateral condyle. This is medial condyles. And this is tibial tuberosity. Right here, this is the anterior border or anterior crest. Down here, this is structure, this is medial malleolus, and if we turn around this, there is a bump right here. This is the place where the fibula will attach and make tibiofibular joint. This is the distal tibiofibular joint, and above here, where the head of the fibula will attach, this is the proximal tibiofibular joint. Let's have a look on the fibula. This is head of the fibula. You can see this is the very chunky structure, and you will turn around. This is the lateral malleolus. You can see this is the very flat. You can differentiate. This is lateral malleolus. Now let's have a look on foot. These are the metatarsals 1, 2, 3, 4, 5, and these are the phalanx. This is proximal phalanx. This is distal phalanx. This is proximal. This is medial. This is distal. Same for others. First, let's have a look on the arches. This is the medial longitudinal arch, this is the lateral longitudinal arch, this is the transverse arch. And now let's have a look on the tarsals. This one is the medial cuneiform, this is intermediate cuneiform, this is lateral cuneiform, this is cuboid, this is navicular, and this one is talus, this is calcaneus.